Beginning Tuesday at 8 a.m., all non-essential businesses are closed. All Delawareans are instructed to stay in their homes, except when going to or from their place of business if it's permitted to stay open, or except to participate in a very specific list of approved activities. Those approved activities include going to the grocery store or to the doctor or going for a walk outside, as long as you practice appropriate social distancing. We're imposing these new requirements for several reasons. First, we're starting to see an increase in the number of cases in Delaware, and we want to stem the rate of community spread. Second, we're very concerned about the ability of our hospitals to handle a surge in volume. Third, neighboring states have taken similar action, and we don't want Delaware to become a destination for residents of other states seeking a more permissive environment. And finally, not enough people have taken our previous guidance seriously. I've seen way too many people in groups and gatherings of more than a handful of people as I've traveled across our state. We all read the news and know what's happened in other countries and in other states in our country. I don't want Delaware to be the example of what not to do in response to this crisis. I understand that these restrictions will have real consequences for real people, but the consequences of not imposing these restrictions are way too serious. I know many businesses will have questions about whether their activities are restricted. You can call 302-577-8477 or email COVID-19FAQ@delaware.gov. That's COVID-19FAQ@delaware.gov if you're not sure. I know many citizens will be wondering whether certain social activities are permitted. My advice for you here is really very simple. When in doubt, don't. Stay home. For the businesses that are still operating, we're holding you accountable for providing a safe working environment for all your employees. If you don't follow the CDC guidelines, we will have no choice but to shut you down too. The more seriously we all take this now, the sooner we can get to the other side of this crisis. Government can only do so much to stop the spread of coronavirus. Most of this is on us, you and me, the people of Delaware. We all need to step up. We all need to do our part. Your actions affect your neighbors, and their actions affect you. That's what today's announcement is all about. We can do this, but we need your help. Next, I'd like to introduce Dr. Odom Walker for an update from the Department of Health and Social Services.
Thank you, Governor. First, let me update you on the number of cases we have. As of Sunday afternoon, we now have 56 positive coronavirus cases statewide. 39 are Newcastle County residents, 5 are from Kent, 12 are from Sussex. Unfortunately, 6 people are hospitalized statewide, including 3 in critical condition. As the governor said, the more the coronavirus spreads, the tighter the restrictions we need to employ to protect the people of our state. You've heard the new restrictions from the governor, and now we all have a role to play in slowing the spread of COVID-19 and protecting ourselves, our families, and our neighbors. We need to take this virus seriously. No more gatherings on a boardwalk, no more sleepovers, no more standing outside in a group for ice cream. This virus is highly contagious, and anyone who is infected, whether they know it or not, can spread it to 2 or 3 more people. We all need to model our actions as if we already do have COVID-19. And it's not just for the protection of seniors and other vulnerable populations, although they do remain our greatest concern. As of this morning, about half of the lab-confirmed cases in Delaware are in the 18 to 49 age group. That's why we all must end unnecessary contact with others, continue to practice social distancing, go out for essential groceries or prescriptions only as needed, and go to work only if we're in an essential business. That does not mean you can not go outside. In fact, we encourage you to go for a walk, run, or bike ride in your neighborhood or a local county or state park. Staying active while avoiding groups and maintaining social distancing will keep us all mentally and physically healthy. Now, let me say a few words about testing. Starting Monday, in partnership with the healthcare systems in our state, we will begin a statewide testing program. And please hear these next words. In order to be tested, you must have a referral from your primary care doctor, or better yet, through a telemedicine service associated with your health plan. Once you have that referral, you will be directed to a testing location. If you do not have a doctor, please call the Public Health Call Center at 1-866-408-1899 or 711 for individuals with a hearing impairment. An operator will connect you with a medical professional to evaluate your symptoms and make a referral as needed. This is critical. Please do not go to your local emergency room. If you have symptoms, you could infect others. It's important that the emergency departments are as free as possible to care for the sickest people. And just a reminder about the symptoms of COVID-19 that you are likely to require that you will be tested. And they are a fever and either a cough or shortness of breath. If you are healthy and free of symptoms, we need you to stay that way. You and your family can help by following those steps we've repeated so many times. Wash your hands often and for 20 seconds, including the backs of your hands and under your nails. Clean commonly used surfaces often. Cough or sneeze into your elbow, and if you use a tissue, throw it away immediately. And if you're sick, please stay home. Call your doctor or consult with a telemedicine doctor to see if you need to be tested for COVID-19. And if you are healthy and do go out, practice social distancing. Stay 6 to 10 feet away from the next person. At home, make sure you're eating healthy meals. Try to get a good night's sleep. And as I said, stay active regularly. Finally, as a mom of 2 little ones and as the daughter of older parents, I understand the worries that so many Delawareans have today. We will get through this crisis by sticking together, offering support to one another, and by doing what we can to support those in need in our community. If you do have questions, that number again at our Public Health Call Center is 1-866-408-1899, or send an email to dphcall@delaware.gov. Please visit our website for current updates, de.gov/coronavirus. Our Division of Public Health and our healthcare system expect infections and hospitalizations to increase even more in the coming days. So we promise to keep you updated with the information you need to keep your loved ones safe and healthy. And if anyone in your family gets sick and will need to get them tested, we will work to make that happen as quickly as possible. Thank you so much.
Thank you, Dr. Walker. As I said, the more seriously we all take this now, the sooner we can get to the other side of this crisis. Thank you very much, and God bless each and every one.